gifts to you. So thank you for your hard work. Enjoy those. Enjoy them with your family if you wanted to give them away. But again, thank you for your hard work. Congrats.
A round of applause again for Mr. Robinson for taking us through this. He's a senior official from the U.S. Embassy to make her remarks. Madam Paro, please.
Great to be here. I am so actually getting involved in the workshop and absorbing as much, and I love when you guys are internalizing it and making, and I got to see that, and it has been great to see how all of you guys are working together, and you know, and it was lovely, and I hope you are going to take as much as you can back to your facilities and share it with your colleagues, share it with the inmates, so that you can really teach them, everyone, about mental health and how to take care of yourself and how to take care of each other. So that, and this is not the last of our support. This is a very important support project for us, and
it's been very uplifting for the officers who attended this. And of course, as you heard, it is part one where the directors and the senior staff from the region attended this, and it was for Correctional Service Week that ended last Thursday. This is a step forward in the right direction. At this time, Head of Department for Probation and Aftercare Services, the Secretary, Probation and Aftercare, Dr. Christina Nobondi.
Thank you. Thank you very much, our Commandant, our guest of honor, Secretary, Dr. Salome M-Beacco, Commissioner General of Prisons, and our well-esteemed partners and sponsors. Dear colleagues from the State Department for Correctional Services, good afternoon. Exciting to see that our colleagues here, the training of from INL in us and the parent in us. More often than not, we get stressed because we don't have, when you're dealing with offenders in correctional services, that you ought to have a sense of humor. Other mates and their victims in you, and have no life for yourself. With this major step, we'll all make a difference in service delivery. Madam PS, thank you for the visionary leading us this journey into self for better service delivery. And thank you very much, our partners, for supporting us too, and how best you'll start within your station before you reach out to the neighboring stations. Thank you very much, and may God bless us all.
So much, the Secretary of Probation and Aftercare Services. Madam PS, indeed, this Commissioner General, sir.
Our PS Correctional Services, Dr. Salome M-Beacco, the Director General, Ministry of Health, Obondi, Deputy Director, INL, U.S. Embassy, Senior Corrections Advisor, Bureau of International Narcotics and Law Enforcement Affairs, Mr. Richard Robinson, Commandant, Prison Staff Training College, directors present, my fellow colleagues, good afternoon. It's just last week that we had our Correctional Service Week. The conference, Madam PS, was extremely, very successful. And I think you colleagues, because majority of you attended, you can attest to that. Is it true? This is a follow-up of what we did last week. So basically, we are building, and you are you are fortunate to be the select few who have been picked to continue with what we were doing last week. What we were able to benefit out of the conference last week was immense. And from the feedback that I've received from quite a number of you that I've been able to talk to, Robinson, you have done a great job. These people are so very positive. They are saying that they would want to sit under your training once again because it will be a different lot. This lot has benefited quite a lot. So supported us quite a lot. I think Robinson may remember around partners who are more than partners. They are like part and parcel of us as State Department for Correctional Services. If none of the other participants who are here will be able to say this, want to say, Paru, thank you very much. Thank you very much, Madam PS. Thank you very much, Madam PS. For you, you have been able to see what the partners who have stood with the State Department for Correctional Services. I'm not going to talk about what else should I be talking about. I can only say it was by design that none other than Dr. Moth, for you who are around particularly during COVID time, he supported us quite a lot. I was the then director of logistics. We worked very closely. I remember the day we took the first jab, he was there. We took the first jab, he was there at Amphitheater Prisons Headquarters. So you can see he has worked with us in many other aspects, and now today he is here to close this training for mental health. And I believe we are all, none of us is suffering, right? Yes, or be cured for you to be able to disseminate and transfer the knowledge that you have gained from here to others. So I want to encourage us, once we go to our respective working places, please take advantage of the knowledge that you have acquired this week and last week. Understand that mental issues, mental wellness is key. It's crucial for the service delivery and above all for our very own good ourselves. The kind of things that we grapple with day in, day out, the challenges are many. Sometimes we have no one to talk to about the issues that we go through, but you must ensure that you yourself, you deal with your own issues. Look for the people whom you can be able to talk to. During our conference, a number of officers said those who are maybe our counselors are below us by virtue of their deployment and all that. But you see, at the end of the day, I am a Randu. I'll still remain a Randu when I'm the CG. When I'm out of this office, I remain the CG. Help, when you go to the hospital, you don't look for people on the basis of what rank, for instance, they hold in the hospital. If you're supposed to see a clinician, it is a clinician. If it's a medical doctor, it's a medical doctor. If it's maybe a specialist, it will be a specialist. It doesn't matter when those people are employed. Let us take advantage of the people who are around us. Sometimes we are looking for help so very far, yet help is with us within our working places. These are professionals. They are, specialized in whatever they do. Let us respect that aspect, and we have no doubt that they'll be able to maintain confidentiality even when they are dealing with us, right? So I want to encourage us, take advantage of the training. We have so many officers under us. We have so many clients under us. We have partners. We have even, clients in terms of those who work with us within the organizations that we are managing at the station level. Let us understand that sometimes, particularly as officers who are uniformed and we carry firearms, kindly try to ensure that you have time for your officers. Whether it is what we call through parades, whether it is through when they make applications to see you, whether it is maybe having regular meetings with different on amongst the institutions that we have had so many accidents. We wouldn't want them to continue to recur. We, the managers of these facilities, probably we are the issue. Maybe to people, you talk down to people, understand them, the positions we hold, these are appointments. And the appointing authority can disappoint you tomorrow. Is it true? Learn to respect people. Respect it's two-way. With those many remarks, it's my honor and duty now to invite the Principal Secretary, State Department for Correctional Services, Dr. Salome M-Beacco, to talk to us and continue the program. Thank you very much.
Mr. Patrick Arandu, Commissioner General of Prisons, Dr. Patrick Amoth, Director General Medical Services, Ministry of Health, Dr. Christi, representing PS Hilary Kimutai, Dr. Christine Obondi, Secretary, Probation and Aftercare Service, the Commandant, PSTC, Angus Masoro, the Director, Deputy Director, Bureau of International Narcotics, Parvati Sankar, Senior Corrections Advisors Bureau of INL, Richard Robinson, Senior Officers drawn from the State Department, distinguished participants, ladies and gentlemen, good afternoon. Has it been worthwhile? It's been worthwhile. Okay. So mental health transcends the traditional boundaries of disease. It encompasses the overall well-being and positive emotional experiences. It is about our lives, our work, our relationships, our physical health, our social environment, and our fundamental human rights. Today, we take a pivotal step towards nurturing a healthier, more supportive atmosphere within the State Department for Correctional Services, reinforcing the idea that health in all its entirety must be prioritized holistically for both staff and clients. Realistically, there is no health without mental health, and health is the greatest wealth that you can have. Mental health challenges are not confined to specific demographics or backgrounds. They can affect anyone. They transcend riches, they transcend age, they transcend social status, they transcend educational background. Anxiety, depression, phobias, and eating disorders can manifest in individuals across all walks of life. It is therefore crucial that those experiencing such symptoms to feel empowered to seek help without fear of stigmatization. Often, we openly discuss physical ailments while remaining silent about our mental struggles, mistakenly interpreting this silence as a personal, far-reaching, not just for individuals, but also our economies and overall societal outlook. It is therefore imperative upon us to adopt a holistic approach that emphasizes prevention and early intervention. Prevention involves cultivating resilience among our staff and clientele, creating an environment conducive to mental health and well-being. Early warning intervention ensures that support is accorded promptly, potentially averting a decline in mental well-being. Currently, mental health services can be fragmented and poorly understood by those who need them most in a situation that demands urgent reform. As a department, we are committed to enhancing mental health awareness and services. With initiatives like the launch of the National Guidelines on Workplace Mental Wellness, we are taking significant steps towards offering targeted support to those who require it. Through collaboration with stakeholders, we purpose to disseminate the national mental health, empowering our staff and clients to prioritize our health support that INL has graciously accepted to help us develop our own customized. I think they must have been influenced by the outcome of this workshop. You must have really, we are very gratified and humbled by your indication that you are willing to support us to develop that policy, the manual and the manual and the curriculum, so that we continuously and we continually provide mental health care for all our staff and for all our clientele. As a department, we are committed. Available statistics paint a stark picture. Stress and burnout account to nearly half of all lost working days. This is unacceptable. Work should not be a source of illness. Rather, it should foster growth and well-being. Therefore, we must all commit to raising awareness about mental health and collaborating to enhance preventative measures. Ladies and gentlemen, we often hear the phrase, "It is okay not to be okay." I want to urge you to add this. Speak up. Let your whispers become shouts. When you voice your struggles, others will listen and respond. Today, we are highlighting the significance of mental health and encouraging those in need to seek assistance. In Kenya and indeed globally, for our staff, allowing us to confront these challenges head-on, and the figures speak for themselves. Estimates point that 20 to 25% of outpatients seeking primary health care present symptoms of mental illness at any one time. While the government statistics indicate that at least 1 in every 4 Kenyans suffer from a mental illness at one point in their lives. Behind these statistics lie millions of personal stories. Addressing mental health is therefore both a social and economic imperative. For all these reasons, non-action is simply not an option. The training that we are closing today is an important step towards a healthier State Department where the psychosocial needs of staff and inmate, including the most vulnerable, are at the heart of our efforts. I believe that with this initiative, we will bring mental health to the spotlight, stop mental health problems being considered a taboo. We recognize that it is okay not to be okay. And for this, let us adopt a people-centric focus working towards one basic, simple, universal right to care for people suffering from mental health problems. You will agree with me that the premise is that everyone in the State Departments who needs care, or every day I feel his presence in my life. And very often I feel like crying. So a long call, a nurse has to come and help her. Everything is done for her. If she needs to turn, a nurse has to come and do it for her. If she needs to be cleaned or to be scratched at the back, a nurse has to do that for her. I think one of the things we as Kenyans need to cultivate is a genuine spirit of gratitude. A genuine spirit of gratitude. And with that, the counter of that is refusing to complain. And instead we think are not up to standard. Rather than complain about them, we can pray for them. I always take the view that if we prayed for those people we think are not doing what we want them to do, half as much as we complain about them, they would actually become saints. They would actually become saints. And one of the greatest beneficiaries in that process is ourselves. That we would criticize less. We would fault find less, we would gossip less, we would undermine less, we would lie less, we would, we would be peaceful people. The number 2, besides gratitude, is a spirit of being positive, positivity. And what does this look like? To always have a positive attitude, to always look at the glass as being half full rather than half empty, to see the good side of life, to see the good side of life. Good farmer and bad farmer, they were very, very good friends. And all the time when there was the sun shone, the good farmer would say, "Thank you, Lord, that the sun is shining." And the miserable farmer would say, "It's too hot. Now all our crops are going to dry up." trains, the good farmer says, thank you, Lord, now our crops will grow and we'll have a dog. And they went towards the river, and the good farmer told the bad farmer, can do, and he threw a ball into the river, and the dog walked on the water, went and retrieved the that I'm not a doctor, and Dr. Patrick would say that is not true. But statistics show that if you're a positive person, you probably age less. Hypertension, less this, less that. Of course, you need to take care of what you eat and how much exercise you do, but that could really be successful. If you want to be a happy, positive person, who, of course, it starts with all of us. If you're the person, if you keep the company, Miguel, yes. Show me your 5 friends and I'll tell you who you are. Show me your 5 close friends. I would rather have 2 good friends rather than 50 bogus friends. And so you need to check. Do your friends build you up? Do your friends challenge you to become a better person? Do your friends affirm you? Do your friends, encourage you? Or do your friends always put you down and criticize what you are doing in them, which they cannot deal with, and that therefore you cannot tell them, show me who your friends are, and I'll tell you who you are. So it is important for our own mental health that we make of course that doesn't apply to your spouse. Maybe your spouse, you need to pray for them, or you yourself, you change. Or you yourself say, that is my iron that is sharpening me to become a better person. But in general, where your friends are concerned, those people you can choose not to be with, I think for your own mental health, it is desirable that you do not keep such company, because they will send you to an early grave, number 1. Number 2, they will send you to get sickness. And number 3, they will always impede your progress. So it is important that we choose what we are, who we choose to mix with. Don't answer the door to gossipers, complainers, discouragers, compromisers, and fault finders. Always mix with people who see your potential, who build you up, who challenge you. And the same thing, because your leaders correspondingly, because your leaders where you are, you have been put in charge of people, and therefore you are to care for them. It is important that you do not be enablers or be toxic people, so that people who work under you find joy to come to the office. People who work under you feel understood, feel forgiven, feel loved. They feel the kindness and the fact that you are able to let go of what offenses that might have been done by them. They feel that they can be guided, that they can be molded to become better persons, to rise higher, to go further, to do more, to do better. And with those many remarks, kindly let's be upstanding to welcome the representative of the PS Hariki Mutai, Dr. Patrick Amoth.
General for Prisons, Patrick Arandu. Correctional and Aftercare Services, Dr. Bondi. Our 2 senior officers, ladies and gentlemen, good afternoon. Medical Services, Mr. Harik have officiated this function, but because of exigency, to be able to launch the regional roll-out program for the country, Social Health Authority. It is with great pleasure that I join you today as we conclude. Mental health is an essential for well-being that enables people to cope with stresses of life to the community and society. By virtue of the unique demands, prisons and aftercare services or being viewed as weak. For us as a country, the trajectory, and this came into the fore during the COVID-19 pandemic, when, because of the measures that we put in place to be able to control the pandemic, then exposed our soft underbelly in terms of our mental health services. To address this, the Ministry of Health has come out with clear policies, guidelines, and frameworks to be able to institutionalize mental health care services as part of the overall healthcare services. As we journey together towards the achievement of universal health coverage, that is premised on a primary health care approach, then it is important that we don't deal with mental health services as a silo, but rather integrate it into the existing health services platform. Holistic approach to improve mental health, not only in our health facilities, but also in correctional facilities, and encourage the establishment of workplace wellness committees that are tasked with creating in your space where you lead, to be able to ensure that you have these committees in, to be able to support each other with mental health challenges. This creation of a supportive environment then will lead to the reduction in stigma associated with mental illness by creating awareness on the importance of mental health, regular training on how to recognize and respond to mental health challenges, and to be able to equip staff with skills in conflict resolution. Madam PS has actually clearly stated to us after her main speech of the toxicity that exists in our workplace. And I would dare to add, it's looked at with suspicion. However good it is, people will try to punch holes in everything that the government is trying to do. And when you sit with them one-on-one, they realize that they are punching holes into something that they have not simply understood. It is imperative for us then to be able to bring all these facets in terms of our service delivery in our day-to-day delivery of services, but also how we interact with our colleagues to be able to articulate the correct positions in all this, including mental health, because that stigma comes as a result of lack of information. You have now been empowered to be able to pass the correct information to your colleagues and also other people outside your place of work, so that you can be able to support each and every one of us that will lead a healthy lifestyle and we can be able to achieve our full potential. Well-trained staff can handle difficult situations more calmly, effectively, thus reducing the emotional burden that comes with frequent altercations at the workplace. As a Ministry of Health, we have developed the benefits package, and we have put a lot of emphasis on mental health way back from the primary healthcare facilities, but also at community level through the community health promoters. If you go to a level 2 facility, level 3 facility, we are integrating mental health services with the overall health services that we continue to deliver. That way we can be able to promote better health, prevent illnesses, and therefore reduce of providing health care. This training program demonstrates commitment by the State Department of Correctional Services towards investing in prison staff mental health and wellness. By equipping you with knowledge and skills related to mental health, we are not only investing in your well-being, but also enhancing your ability and capacity to provide effective care and support to the individuals in your workplace and under your custody. We have done a study as a country, and the burden of mental illness costs us 2% of our GDP, either because of absenteeism, presenteeism, where I'm there but I cannot be able to deliver anything, actual curative services or treatment and rehabilitation and reintegration into our communities. With that kind of loss going forward, and with the fiscal space that we emphasize health promotion and health prevention to be able to deal with these huge burdens. During COVID-19 pandemic, we did not realize the challenge that we had with mental health. In the entire health workspace, including that teaching and referral hospital, to explore other expertise that is needed to be able to offer mental health services. The burden of suicide in this country, the number of people we lose every day, to address this challenge. The definition of health by the WHO, the Global Health Authority, the absence of a disease or infirmity. Therefore, it is important that going forward, we at inpatient level is available for all Kenyans at individual level. We are going to pay 168,000 shillings per person coverage. It is a significant investment to be able to ensure pleased that Madam PS has picked mentally healthy and supportive environment, National Health Insurance Fund towards the social health insurance. Their population of more than 52 million Kenyans behind. The definition of universal health coverage is that everybody has access to health inclusivity and equity, and ensure nobody is left behind in terms of health service delivery. Purpose every Kenyan to access in terms of contribution. Department number 2 is the social. Our 2.75% for those of us who are salaried, like all of us here, but also 2.75% of the gross income of somebody in informal employment. When you log into that platform, it will ask you a series of questions, and through artificial intelligence in the background, it will be able to, because this is now hospital services, level 4, level 5, level 6, and treatment contributing a single cent. The reason for this was to be able to cure the challenge that we had of many people waiting areas or parking spaces in ambulances, waiting to fundraise in the middle of the night 300,000 Kenya shillings as deposit for ICU. So for now, if God forbid something happens and you require emergency services in any health facility, whether accredited or not accredited, for the first 24 hours, the government of Kenya will be able to pay for you. In this financial year, we allocated 2 billion shillings. I was in a meeting with the SHA people. Up to now, nobody has lodged a single claim to be able to access that service. Maybe our challenge is communication. We need to be able to trumpet that to Kenyans so that they can be able to access that service. So that is the fundamental departure from NHIF to SHA. NHIF 1 port, SHA 3 ports. Out of the 3, 2 you can without any payment. The middle port you have to be able to compulsory. It is for all Kenyans. The reason it is compulsory is because we are talking of social health insurance. So that the young people will contribute, but because of the very nature, they are not unlikely to fall sick. Their premiums will be able to cater for the old people who have coexisting medical conditions. The healthy people who contribute, there are people who complain, I've contributed 10 years, I've never utilized that fund. But some, your cousin, your brother, your in-law. And then those of us who are well endowed with resources will be able to pay slightly more so that we can be able to cater for the indigents. I was telling Madam Pierce that the people under your custody, those who are in the correctional services, they don't have an income, but they require healthcare services. So the government is supposed to pay their premiums. And this time we have decided to consolidate all premiums for all indigents, from prisoners to the very poor and vulnerable people in the community, under one pot, so that we can be able to reduce the operational expenses. I think that will be able to shed light to you so that you can be able to, in your own space, to articulate what SHA is all about. I am confident where I sit that this is the right direction to take. It is 1 month since we implemented. We have had teething problems, but we will continue to soldier on together with all the stakeholders. the noise is getting, we are getting reduced noises by the day. Now instead of attending to 10, 50 complaints in a day, maybe you are only getting 4 or 5. And that is why you are now going to the ground at the regional level and also at the county level, working through the SHA offices, the ICT, the health facilities, to be able to troubleshoot and ensure that going forward we have laid a foundation to improve the health of Kenyan people going forward. With those very many remarks, it's now my honor and pleasure to declare this workshop officially closed. Thank you.
Thank you so much, Dr. Moth, for that. This side while we organize, Dr. Moth, for that. This side while we organize for the participants to come before you and receive the certificate.
But because of the unique nature now that they're in incarceration, even Linda Mama is an insurance subsidy program, and therefore we are trying to would be able to access health services from any facility, including treatment overseas if that is.
Thank you. Thank you so much for that clarification. Thank you so much for that clarification. Now for dear participants, we'll approach from this end as we see the guests and Baraza. The names are alphabetical, so please guess your position. David Baraza. Next. David Kula. David Kula, please. David Mukuha. David Mukuha. Doreen Anabaka. And we have Elizabeth Mweni. Elizabeth after Doreen. We have Elizabeth Mweni. We have Eunice Awino. Eunice Awino. We will have Euphenia Nabire. After Euphenia, we have Felicina Mbriga. Sorry. We have Florence Mweni, please. We have George Odunga. George Odunga, your names, please. George Ouma. George Odunga, George Ouma. George Odunga. Hussein Mohammed Guyo. Jacinta Nduku Mutua. We have Jacqueline. We have Jacqueline Amondi. We have James Njoroge. James Njoroge, please. We have James Otieno Obiero. After James Obiero, please follow up. We have John Karime Gisheru. Johnson Madime. After James. You're in front. John first, then Madime. Then we have Josephine Oderi. We have Justina Ongombe. And then we have The next Lydia. After Mary McKenna, we have Marianne Wanjiru. Marianne Wanjiru. After Marianne Wanjiru, we have Mercy Wambui Njoka. Ndiema. Moses Ndiema. Mohamed Dude. Immediately after Paul Ekotan, then we have Peter Limo Komora. Peter Mwangi. Peter Obero to follow. B. Ruth B, please follow. Ruth B, Ruth Mora, thank you. That one you'll advise Susan. We have Sami Nguta, Kipkemoi. Please proceed. Thank you, sir. If it may please you, before we take our official photograph, if you'll allow me. Eunice, please.
Medical Services, Dr. Patrick Amoth, PS State Commissioner General of Prisons, Mr. Peter Randu, the Secretary to Probation and Aftercare Services, Dr. Christine Obondi, the sponsors of this workshop are very competent facilitators, Mr. Robbins, and Director Welfare and Rehabilitation. Good afternoon. I'd like to take this opportunity to, with all the to be here. Without God, we would not be alive to learn anything. So we thank God most sincerely for allowing us to be here for this very, very valuable trip. My next vote of thanks goes to Madam PS. Thank you for this very well thought idea. Paul said yesterday that this is an idea that was here. Some of them are leaving this place as doctors of mental wellness. And the family of Prison Staff Training College for all that you, everything together, to make sure that we are seated on time and did what was necessary. We truly appreciate you. Robinson, I want to specially register the appreciation of these participants. You are just competent. And we wish you all, we know this is going to go a long way in improving the Kenya Prison Service and the probation service in the manner in which we will be handling our clients. With those many remarks, sir, allow me to say asanteni sana, Mungu awabariki, God bless you. Thank you, sir.
Thank you so much. Our closing prayer, please. Our closing prayer. Please just go ahead.
I'll lead in prayers, which will be, I'll read from the first surah of the Quran. It is also equivalent to the Lord's Prayer in the Bible. So let's Alhamdulillahi Rabbil Alameen Ar-Rahmanur Rahim Maliki Yawmi اهدنا الصراط المستقيم صراط الذين أنعمت عليهم آمين.
Thank you so much, our guest.